Psychodrama in occupational therapy. What is your opinion? Hi, I'm Louise Fouché from OTGrow and welcome to our YouTube channel. Today we're going to be unpacking a little bit the concept of psychodrama in occupational therapy. And I am pretty sure, I know it has been a very controversial subject of late. And I want to bring some points to your attention and then to leave it at that. And I'd love to hear your opinions. It was also something that was approached and discussed at our conversations around the history of occupational therapy groups in South Africa. And if that is our history, we were having a look at how to take things forward. So today I want to kind of focus a little bit specifically on psychodrama. One thing that was quite interesting is that Rosemary Crouch, who has had such a phenomenal impact on the OT profession, not only in South Africa but worldwide, during our panel discussion, brought to light the fact that when she started training in the 1950s, group work was not part of occupational therapy. But what also came to light is as she developed some of the group modules, she really put focus on psychodrama and became interested in psychodrama. So much so, she actually did her master's degree when she was on psychodrama. So I want to read two things to you, which is written by Rosemary Crouch. On one is on a letter and one was on a document around psychodrama. So the first one I want to read is just in terms of what she said. My interest in psychodrama continued, and very soon Viv Arles joined me, although she trained in different group techniques called the therapeutic spiral. I was trained at a fabulous workshop in Oxford in England, and later Viv and I trained together in France. We had such fun. So I think the one myth that is out there around the psychodrama and occupational therapy in South Africa is that our occupational therapists have not been properly trained in psychodrama, which was not true. The other thing to keep in mind is that after Rosemary Crouch and Viv Arles had had training in psychodrama, there was a stage when psychodrama was actually offered as an undergrad as part of our OT qualification. Then in around the 1990s, there was people that felt that our undergrad students didn't have the emotional maturity to really deal with psychodrama. And there was then a move to do psychodrama training on a postgraduate level. Unfortunately, at that time, there weren't very many places that actually offered psychodrama postgraduate training. And so slowly but surely, psychodrama has been moved to the periphery of our skills as occupational therapists. Although Rosemary Crouch and Viv Arles still very much were passionate about psychodrama, slowly, because it wasn't being presented on an undergrad level, the exposure of undergrad students to psychodrama diminished as time went on. And as people that graduated and had not been trained in it became lecturers, then that also diluted even more. What I would like to also bring to your attention was a letter that Rosemary Crouch wrote to Moreno when he was still alive and asked about psychodrama training for occupational therapists in South Africa. And I'd actually like to read you verbatim the feedback that was written to her by Moreno. All right, so it says here, and this is what Rosemary Crouch wrote. Psychodrama is a technique that is by no means confined to one profession. In a letter that I have in my possession, this was Rosemary Crouch, written to me from Dr. J. L. Moreno, he says, and quote, "We are much interested in hearing of your activities in psychodrama. Many occupational therapists in this country, which is in America, and abroad, have in fact been active in psychodrama. And if we do not specifically refer to it, that it is largely due to the fact that we are an all-inclusive group who believe that everyone who works with people should be exposed to these methods." And that's very interesting that that is verbatim from Moreno. So in our conversations about the history of groups, OT groups in South Africa and where we are going, the topic of psychodrama was brought to the fore again. And we had a panel, but we also had a lot of people in our audience. And the question was posed, should we continue with psychodrama? Should there be a renewed interest, renewed training in psychodrama for occupational therapists? And it was unanimously decided at this conversation that psychodrama should be brought back and provided postgraduate training for occupational therapists to use in different settings. But one of the provisos that was so strongly put forward is the fact that it should be within occupational therapy scope of practice, because the HPCSA does not have a place where psychodramatists can go and register. At this stage, our HPCSA recognizes that occupational therapists, not psychodramatists, occupational therapists, are allowed to do psychodrama with the necessary postgraduate training. And I know this might be controversial, and I'd love to hear your comments. I know for a fact there are people who feel very different about this, but I want to just bring up, in terms of some of the collective history that we've gotten, how groups is so parallel to the development of psychodrama as a skill for occupational therapists in our group journey, and where we are going forward. So first of all, I'd like you to drop a comment. Do you think psychodrama should be part of occupational therapy scope? And do you think we should continue and really make a point of training our occupational therapists properly in psychodrama? Maybe if you have some exposure to psychodrama, what do you think is the value that as an occupational therapist you present psychodrama? What do you bring if you also have the skill or the tool in your toolbox of psychodrama? I'd love to hear what your opinion is on this. For those of you that are unsure, keep your eyes and ears open. We are having our second conversation on the 17th of October, and I'm going to be posing the same question to our new audience. You're welcome to join us, and I will report back to you on what the feeling is with regards to psychodrama. What I do think is important is that we make an intentional decision as a profession about where do we want to go going forward. Do we dust off psychodrama and go forward with it, or do we say that our profession has changed and there's no longer place for it? At this moment, it was a unanimous decision to take it along, dust it off, and revive it. But let's see what your opinion is and what happens going forward. In the meantime, happy facilitation.